How you doing? My name is Hart, co-creator of Back Pain Relief for Life and pre-postnatal certified. And today what I'm going to speak to you specifically about is pregnant and getting back pain relief. Back pain relief is normal during pregnancy, but there are many things that you can do to get rid of that back pain in an all-natural, simple way. So I'm going to explain to you a little bit about what happens to your pelvis when you become pregnant and you start to show, specifically when you start to show. And sometimes people have this issue without even being pregnant. It's just a part of the anatomy. And there's ways we can get back to a neutral position that allows you to eliminate your back pain and in general feel great, especially during pregnancy, because there's certain things that happen that we want to strengthen certain muscles and then stretch other muscles, not only during pregnancy, but once you have your child, you want to recover faster and be strong for the baby so you can carry the baby and hold it and still move around properly. Okay, so first I want to go over the neutral position of your pelvis. So a neutral position, just think of this as a cup. Your pelvis is like a cup and it's holding water. And right now it's in neutral position. It's flat. There's no water pouring out. Now, when you become pregnant, as the anatomy changes, what happens is you end up in an anterior pelvic tilt. So think of it this way. The pelvis tilts forward as if there was water in there, it would be pouring forward. So it's tilting forward. And what that does, it puts excessive stress on the lumbar spine. So there's more pressure on this lower back right here. Think as your stomach is pushing out, there's a lot of stress right here on this lower area. Then your abs begin to weaken. So you have a muscular imbalance. The front is weak and the back is tight and overactive. So front is underactive, the back is overactive. So what we want to do to increase or bring the pelvis back to neutral, which might only be temporarily because your pelvis is going to be changing as you're pregnant, but we want to strengthen the abs in a specific way and then take pressure off the lower back. So there's a few ways we can do this, and we're going to show you two specific ways that you can do this. Two exercises that one will strengthen your abs and put your pelvis back into a neutral position, and then two is a stretch that you can do to take the stress off your lower back. So we're going to show those movements right here and now. So go ahead and do those movements. All right. So you're going to do the first exercise, which we call the knee pull, 3 sets of 8 repetitions. And then the stretch that we show you, which we call the chrysalis, you're going to do 3 sets and holding it for 12 seconds. And I want you to try to feel a stretch on the inner thigh and your lower back. And don't do it excessively. If you've seen our other videos, when you're pregnant, there's a hormone called relaxin that causes your joints to be extra laxing. So we don't want to overstretch and overdo any stretching on the ligaments. So just feel a good stretch for 12 seconds, relax. So go ahead and do that now. And before you go and do that, if you're interested in a back pain relief program that's going to help not only your lower back, your abs, but also your hips and your entire body, go ahead and click the link below at backpainreliefforlife.com and see if that program will help you eliminate your back pain in a fast, all-natural way, and not only eliminate your back pain, but help you be stronger so that when you have your baby, you recover faster, you feel better, your posture is even better than before, and you don't lose strength and tone. So again, this is Ian Hart with backpainreliefforlife.com and pre-postnatal certified coach. If you have any comments and questions, go ahead and leave it below, and I hope you have a great day. Okay, here we are. I'm about to show you a few movements that are going to help you relieve your back pain, put you in an anterior pelvic tilt, so tilt your pelvis so we're stretching tight muscles and strengthening weak muscles. The first movement is going to be the knee pull. But before you do the knee pull, I want to make sure you're in the proper position. So your head should be propped up with some type of pillow or ball, as you see that I'm using. The hands are flat on the floor. Feet are flat on the floor, knees bent, feet about a foot from your buttocks. And then you're going to start by pulling your knee into your chest. So you're tilting your pelvis, you're activating your abs, and then feeling a stretch in your lower back, and then kicking the leg forward, and then repeating the movement. So it's going to be 3 sets of 8 repetitions on each leg. So that would be, your right leg would be 8 reps, and then you switch and do the next leg. And right away I start to feel stress relieved off my back pain, or on my back I should say, right when I do these movements. So you feel stretching in the lower back, abs tighten. So 3 sets, 8 repetitions. Alright, now the next one is going to be called a knee side dropout. What this is going to be is pushing the leg out to the side, feeling a stretch on the inner thigh, feel your glute medius activate, push out to the side, and then repeating 3 sets of 8. When you do this, keep your abs nice and tight, and keep your pelvis, your back flat, your pelvis tilted in neutral position, and then squeezing all the way out. And then open up all the way. So we're going to do 3 sets of 8 repetitions. I'll show you how it looks on the other side. And right away I feel this helps the back.